Okay, today we're going to talk about a condition that I see pretty regularly. People come in all the time with low back pain, and they'll have like a bulging disc or a herniated disc. They're kind of synonymous terms. And I wouldn't say necessarily that I get excited per se, but I know that this is something that we can treat. I know that it's fixable. So even though it might be scary to hear, get an MRI or have a doctor tell you you have a herniated disc, but it's fixable. Even if you're in a lot of pain, this is something we can treat. Okay, so let's go over the anatomy. So in the low back, you've got the vertebrae, the bones, and between each of them is the disc. And this acts kind of as like a shock absorber, a cushion. It allows movement. And at the top here, you can kind of see like the gelatin portion that allows the movement. As it starts to bulge, it could potentially even herniate and hit that nerve. And you can kind of see how one nerve is inflamed compared to the other. When that nerve gets inflamed, it can send a pain down the leg, and that's what causes a lot of that radiating pain from a herniated disc. Okay, so let's talk about how does this develop? How do people get a bulging disc, or the mechanism of injury? Usually, it will happen when somebody is bent over and they go to lift up something heavy, with poor body mechanics, poor posture, and they lift that up, and maybe they twist and they feel their back go out, or they even hear or feel a pop, and especially get like some radiating pain down their leg. This happens in a lot of different ways, but for example, like lifting up a heavy box. I had a CNA come in the other day. She lifted up a heavy patient in a bad kind of body mechanic posture position and felt her back go out. So when you're bent over, you're lifting, bad mechanics, twist, that often is how this can happen. Okay, signs and symptoms to help you know whether you have this or not. You're gonna have a lot of low back pain. It might be one side versus the other, it could be both, but it's gonna be kind of a pinpointed spot in the low back. And often you get what's called radiculopathy or sciatica. It's basically just shooting pain down the leg. You'll find that when you get into a flexed or a bent position, this will kind of exacerbate the problem. It will peripheralize your pain, if you will, and cause that shooting pain down your leg. Whereas when you extend, that actually helps. It kind of relieves it. Why? Because we're pushing the disc away from that nerve. Whereas in that flex position, you're kind of bulging. Think of like sitting in a car, sitting on the couch in a poor posture, and you're kind of slumped. That causes the disc to protrude posteriorly or to the back. It hits that nerve, causes that pain down the leg. So extension feels good. Flexion typically hurts. So how do we treat it? Whenever somebody comes in and they present this way, we want to know specifically what they're feeling so we can kind of customize the plan to them. But we've got to get you, first of all, into extension. Remember how we talked about that extension relieves it? So we do an extension-based exercise program. We do a lot of like manual hands-on therapy. We do soft tissue mobilization to help kind of stimulate blood flow and reduce the pain. We also do traction. Traction is basically decompression, inversion table. We put someone on traction to help kind of separate the vertebrae, stretch the low back, get that disc to resolve. Modalities that help with the pain, and we'll create kind of a customized plan for you to help you reduce your pain, modify activity, teach you body mechanics, and especially work on strengthening the core. Those are a few things that we'll do to help you. And again, like I started, like this is treatable, this is fixable. You come in with low back pain, specific disc herniation, we can help you with this.